That's a mic check, mic check. All right. All right. Happy Friday. We are in. Hey, good evening, trailblazers of health and wellness. I'm Dr. Joaquin Acosta, your navigator in the ever-evolving universe of healthcare and the CEO of Farm True, where we blend compassion with innovation. Welcome to tonight's edition of Know Your Pharmacist livestream. It is January 26th, 2024, Friday, baby, a day where we're about to make historic news with groundbreaking insights and transformative discussions. As we embark on tonight's journey, we're not just sharing information, we're cultivating a community of informed health advocates. Together, we're building a future where wellness is not just a goal, but a shared experience. Tonight, we delve deep into realms where science meets humanity, where every discovery is just one step closer towards a healthier world. First segment, guys, a parent's worst nightmare, the reality of RSV, is a heartfelt exploration into the challenges and triumphs in pediatric care. Using some UNM Health Systems articles will unravel the complexities of RSV and the hope that new vaccines bring to our little ones. It's not just about statistics, it's about stories, resilience, and the relentless pursuit of protection for our most vulnerable. Next, in Tech Talk, we witness a marvel of medical science, the story of a boy who found his way to the world of sounds through the miracle of gene therapy, guys. This isn't just medical progress, it's 2024. And now a testament to human ingenuity, a beacon of hope for millions whose dream of a world filled with sounds and melodies. Then in our Enlightenment Hour, we challenge the conventions of mental health care. We discuss the dangers of the definition of precision medicine and mental health, exploring why mental health isn't a battlefield, but a landscape to be nurtured and understood. It's a compelling narrative that encourages us to rethink and reimagine our approach to mental wellness. In the Herbal Wellness Corner, we celebrate our partnership with High Horse Cannabis Company, highlighting their pioneering role in the cannabis industry, writing history, not just reading it and open 24/7, 365 here in Las Cruces, New Mexico, guys. Open till midnight over in Hobbs and Chaparral on the state lines. Make sure you're shopping High Horse, and we're going to explore, the nuanced relationship between cannabis and health, breaking stereotypes and uncovering truths. Our community spotlight today shines on our sponsor for this segment, the Baked Chicken Farm, showcasing their innovative approach to cannabis cultivation, their commitment to quality and community, and where to find them here and around New Mexico. It's a story of transformation, growth, and excellence. Lastly, guys, in the Men's Health Minute with the NFL Conference Championship weekend upon us, we dive into the world of sports health and the excitement it brings to our lives. Will Taylor Swift get mentioned or shown in this segment? Well, I guess she already did, but hopefully that was it. So sit back, engage, and be part of this enlightening journey. Together, let's uncover the layers of healthcare and wellness while learning and growing with each other. Here at Know Your Pharmacist, we're not just sharing knowledge, we're inspiring change. So let's begin, guys. Jumping on in our Pharmacist Frontline segment brought to you by Farm True, guys. Very, very powerful story here in this article, almost to just allude to everything that's going on when it comes to RSV and just the rise of the severity of these cases. Last couple of years have not been good here in the state of New Mexico, and just giving you guys an example of a story here for those of you guys with little ones in your lives in one way or another. This is very applicable to all of us here. So, shout out to Brianna Wilson and Tom Szymanski of UNM Health Sciences Newsroom writing this article that I'm sharing with you guys. Parents' worst nightmare, the reality of RSV. So check this out. Lisa Quinones, registered nurse, MSN, CPN, had been a nurse for 17 years when her 2-month-old son contracted respiratory syncytial virus, better known as RSV. Thought I knew the signs to look for, said Quinones, the unit director for the University of New Mexico's Children's Hospital Young Children Health Center. My youngest son went from being a healthy, bouncy, bubbly baby the evening before I put him to bed. The next morning, I woke up and he seemed a little congested. By about midday, I decided I better have him checked out. So, looking at this, every year RSV, influenza, and cold season hit around the same time. Since 2020, COVID has only further overwhelmed patients and providers during respiratory illness season. It does not help that these four conditions share common symptoms like cough, congestion, and fever. For elderly patients and babies like Quinones' son, Journey, RSV symptoms can quickly progress into something that's potentially life-threatening. I brought Journey into the clinic, and by the time we got here, he was already requiring just a few liters of oxygen, Quinones said. Maybe 2 hours later, they decided they needed to transfer him over to the hospital. By the time they made it to UNMH, pediatric emergency department, Journey's condition had worsened. I could no longer see my tiny little baby because there's more than 20 people around him, all professional, all very kind, who wanted the best and were doing their very best to take care of him, but it felt frightening, Quinones said. They made the decision that he needed to be admitted into the ICU, and the next step would be ventilation. Of course, that was traumatic. That would be traumatic for any parent, and I was really surprised how traumatic that felt for me, being that I had that background, 17 years of nursing. Said she spent the next 6 days in ICU with their baby. The first 3 were touch and go in the room next door to her son. Another baby, just 6 months old, was also battling RSV, and she remembers the moment that baby lost their fight. She felt a ton of emotions and felt relieved because she still had her baby, and felt guilt because the other mom was devastated. She's grieving and she's crying. Quinones said she held Journey and did not put him down for the remaining 3 days in the ICU. Cute baby, for sure. Slowly her son's condition improved. Quinones left the hospital with her baby, even though he went on to make a full recovery. To their families forever marked by the experience. It's trauma that comes up time and time again. Every time the season comes around, I see that in parents, they really start fearing. Whether it's pregnant mothers who transition from excitement to worry when they realize they will have a newborn baby during respiratory season, or patients who are hospitalized with RSV and may feel unprepared or overwhelmed by the care in that setting. We were conditioned to freak out about COVID, but in our infant population here, the one to worry about is RSV, and has been this whole entire time. Sneaking up, but vaccines came out this year or last year, and are definitely available now. But moving on, Anna Duran, medical doctor, is the chief associate medical officer for UNM Children's Hospital. She said 98% of children will be exposed to the virus by the time they're 2. She also said the highest at-risk children are children that are born premature, have chronic disease, or are less than 1 year of age. Now, it's hard to prevent your child from never being exposed, she said, but keeping sick children home, regularly wiping down common areas, and teaching kids how to sneeze properly, wash their hands, and cover when they sneeze and cough are all ways to help mitigate the spread of this highly contagious illness. Now, I think we need to add something here about the fact that children at the highest risk for hospitalization are usually babies who contract RSV when they're under a year old or under 8 months. Otherwise, it feels like all children are in danger of having a case like Journey's. This is a good spot to clarify a critical age when kids are most at risk. Now, this year, new advancements in RSV prevention could potentially keep infants and potentially elderly patients right out of the hospital. For our older population there, a RSV and a Brisvo, Pfizer and GSK RSV vaccines got released in May last year. Adults age 60 and older are out. Not all pharmacies may have them, but most do, and definitely worth asking about. The ones that you may not commonly get in a pharmacy are going to be the Beyfortus for children younger than 8 months, or high-risk children up to 19 months. So the one that, infants usually don't get vaccinated at pharmacies. They've changed some things for COVID, but really most aren't going to carry it. So really it's going to be at the pediatrician's office or the hospital office, labor and delivery, those places. But the interesting one here, a Brisvo for expectant mothers who are 32 to 36 weeks pregnant to pass new antibodies to the fetus and protect against RSV protections in newborns. So, I think this is something that's probably going to end up getting worked into that workflow for hospitals and clinics and providers and things like that here in the future. It wasn't such a commodity here in 2023 because they were new. RSV's gotten, I believe, hospitalizations in the state of New Mexico have gotten progressively worse since 2020 over the last 3 years. And so not really sure where we're going to end up this season. We definitely had some spikes already, and January was the time to see some spikes. So we'll definitely get data on that. But in terms of New Mexico, just received more than 6,000 doses of the Beyfortus, right? And again, guys, Beyfortus, Nursivimab, actually the one that the infants are going to receive. UNM worked closely with community providers, pediatricians, and state officials to go to areas that are highest at risk. Obviously, the article is talking how we already noted the Abrevzo and RSV are more available already, and they have been available. But that vaccine actually, I think it's supposed to be like 70 to 80% effective in reducing severe hospitalizations for RSVs in infants. Unless you have been through that situation yourself, or maybe have been a little more sensitive to something like that, you may not be paying attention to those things. But again, a parent's worst nightmare, RSV, for sure is actually, one of those things that you're like, crap, I definitely do not want to end up going through the worst of the worst on that, obviously. But for the fact that, that could be one of the more commonly transmissible viruses that is really, going to cause a lot of, I guess, damage is one word, but I guess not only emotional, but just toll overall there is the one you want to prevent for sure. There's a lot of things when you have a newborn, as someone with a newborn of just about 3 months, is learning. But we got the first RSV vaccine about 3 weeks ago or so. My little set of pediatrics. Happy that we got it done. Other than that, and move on. Let's talk about tech talk, guys. RSV vaccines, one of those kind of slipping under the rug in the midst of COVID boosters and things like that. But in terms of actually important, vaccinations, and COVID, of course, still is important. They changed the recommendations. Now it's down back to the monoclonal from bivalent, and catching up with that for sure. But the chance of high risk crap coming from an infant to getting RSV, such as the chance of a high risk person who's getting pneumonia, those things to me are truly big deals. People that have risk for shingles, right? You get that shingles vaccine. Everybody, of course, had that risk for COVID and influenza, and of course, everybody needs to be getting, take care of that trifecta. I was just, really looking at certain priorities in certain populations, especially for the fact that, RSV may have not gotten talked about at all, for the fact, we could have easily gotten 6 boosters without even realizing it. And so that's all. Still good to keep up on whatever latest COVID vaccine you need. Always, make sure that's the case. But again, some people were fed up with it, some weren't, whatever, and this segment was talking about RSV and the importance of it, in our infant population and adult age 60 and above. But we'll move on, guys. Another cool thing here. Some gene therapy breakthrough. Deaf boy can hear after the first gene treatment in the United States. So, when you really think about the implications of, gene treatment in the United States, I think it's a very important concept to discuss, because gene therapy is only going to advance for even more things, right? Imagine what Barry Bonds could do if he not only could have steroids, but he could have something like gene therapy. So part of the things that go with that are the reasons that gene therapy is also not probably scaled up as fast as it can yet. But where everything be so personalized in a genetic modification and a genetic, phenotypical expression in terms of everything that you think about our human body's homeostasis. And we'll even unpack this a little more in our next segment, the Enlightenment Hour, when talking about mental health and personalization of healthcare there. Just, interesting things to consider. But let's talk about the technology portion first. So, here, 11-year-old boy is hearing for the first time in his life after receiving a breakthrough gene therapy. The Children's Hospital of Philadelphia, or CHOP, carried out the treatment, first in the United States, said in a statement Tuesday that the milestone represents hope for patients around the world with hearing loss caused by genetic mutations. Assam Dam was born profoundly deaf because of a highly rare abnormality in a single gene. Gene therapy for hearing loss is something that we physicians and scientists in the world of hearing loss have been working towards for over 20 years, and it's finally here. What do you know? Generative AI and all this stuff gets released within last year and a half, and all of a sudden we figured out, we're figuring out things fast, right? Gene therapy. Look up CRISPR, CRISPR, if you're looking for some incredible advanced gene therapy, medical science. We've talked about it a little on the show already, but we're not talking about it right now. Either way, looking at that, guys, gene therapy is here. And while the gene therapy they performed there in that patient was to correct an abnormality in one very rare gene, the studies do open the door for future use in another 150 other genes that can cause childhood hearing loss, as said by surgeon John Miller, right? In patients like Assam, a defective gene prevents the production of otoferlin, a protein necessary for the hair cells of the inner ear to be able to convert sound vibrations into chemical signals that are sent to the brain. How cool, right? Otoferlin gene defects are highly rare, accounting for 1 to 8% of hearing loss present from birth. On October 4th, 2023, he underwent a surgical procedure that involved partly lifting his eardrum and injecting a harmless virus which had been modified to transport working copies of the otoferlin gene into the internal fluid of his cochlea. As a result, the hair cells begin making the missing protein and functioning properly. Wild, right? Almost 4 months since receiving the treatment in one ear, Assam's hearing has improved to the point he only has mild to moderate hearing loss and said he is literally hearing sound for the first time in his life. The New York Times reported that despite being able to hear, Assam, who was born in Morocco and later moved to Spain, may never learn to talk as the brain's window for acquiring speech closes around the age of 5. That's wild too, right? I would be curious to see what that data looks like, because has it ever evolved in people who have gotten their hearing back, right? Acquiring speech. Interesting. So anyways, the US FDA, which greenlighted the study, wanted to start the research on older children first for safety reasons. Trial sponsored by ACOS Incorporated, wholly owned subsidiary of Who and More, Eli Lilly, right? Zepbound, as we talked about yesterday, Monjaro, Trulicity and company is one of the several underway or about to start in the United States, Europe, and China, where a handful of children have already been cured. So that's pretty crazy, guys. I mean, the one religious document that I've been aware of, aka the Bible, I don't know anything about it really much else. I'm sorry. But, Jesus could make blind people see, right? And making a deaf person hear is pretty crazy. 2020 freaking 4. How soon is that whole thing going to start really, really fixing some stuff for people? And hope to see it all used good, well-controlled manners overall, but positive things there for young little Assam. So, guys, let's jump into our Enlightenment Hour. Enlightenment Hour here today. Give me just a second. Good grief. I've absolutely been silenced for, way too long. Let's, back it up. All right, so everything we just summed up. This article is basically talking about how looking at the lens of personalized medicine as all the way down to the gene in mental health, right? And when you're looking at that, it goes down to, could mental health problems be genetic function, phenotypical expressions down to someone's gene that causes, depression, anxiety, something else, or the other lens of how does somebody else's genes affect the medications that we put them on to treat mental health. And so, this is talking about us making a dangerous scenario out of this because, precision targeting, as we alluded to in the prior segment, a deaf boy can hear after first gene treatment, right, is hard to dial in when you're looking at mental health care. And so I think where the article is trying to get at is talking about mental health is not a battlefield. Language used to describe suffering carries significant weight. For instance, the practice of characterizing a patient as a fighter battling a disease or viewing an illness as an enemy is deeply ingrained. The connection between mental health and the use of battlefield and warfare metaphors has meaningful implications for how people perceive and cope with mental health conditions, influencing how care goals are set and how treatment plans are designed. And basically, guys, we're talking a little bit about this too, in terms of asset mapping earlier this week, and kind of how, the language that we use does create maybe a framework of a battle or a fight and things like that, or somebody's suffering from this, that, and the other. And what it's saying is the military metaphors, right, amplify the threat in a certain way, superimposing a conflict narrative over a person's lived experience of mental health. Illness is the enemy. Drugs are weapons on the battlefield of the body. Sufferers must soldier on lest they be perceived as not fighting hard enough, which can further intensify stress and isolation. According to Peter Hodgkin, the operational logistics such as of medicine as war metaphors primarily centered around reinforcing the notion that taking action is virtue, viewing patients as passive with doctors, diseases, and medical and technical weapons as the main protagonist. So, it goes on, right, as mental health is a garden, and talking about, truly the different windows and the framings of how we compare and contrast, personalized medicine, and not only from the approach that we take in labeling these things from the healthcare provider side or societal aspect. It talks about here how precision medicine, and this is where I'm going to get into maybe kind of my outlook on the article and the definitions of some things as a whole. But precision medicine neglects complex reality of mental health conditions, which are deeply embedded in personal history, socio-cultural context, and lived experiences. This neglect is symptomatic of market-driven nature of precision mental health care. So, my thing here that I'm looking at as I unpack the article, and why I picked this article for today, because challenging precision medicine, new view, perspective on mental health. So I like the way that it's saying, we are not getting to precision medicine because, if we're looking at one thing like gene therapy, it may not be precision medicine. Even though, maybe the certain Merriam-Webster definition of precision medicine may need to be evolved here in the future, because I think when you look at personalized care, and you want to consider precision medicine, maybe you consider precision care, or however you want to frame it to make it, a more positive and holistic outlook there. But I think, where it does talk about the complexities of the individual or experiences or, everything like that, you look at, sure, maybe there are going to be certain genetic things, traits that come up, that get maybe even embedded. Maybe, if you learn that some, genetic traumatic experience somehow can be passed through multiple generations, leaving you wired to be, a certain type of way that you can fix with a genetic mutation, sure. But I think what we need to consider is the definition of personalized medicine and precision medicine, and really consider, what that's going to be in the future, and, dialing it down to the individual. You look at the individual, and you look at the kinds of drug therapies, sure, that could be there, but a lot of these things that are coming into the, here and now in 2024 are personalized medicine, where you see regenerative medicine meeting that holistic care, and, meeting, the whole entire person, and helping people empower themselves to, kind of really learn those things. Obviously, you look at, the psychology aspect of those things. You're looking at cognitive behavioral therapy, and other different tactics that, therapists will be using either virtually or in person with, trying to get to talk people out and help them dive down into some of those complex, mental unwrappings on how kind of things unfold in their lives. So, I think that precise medicine definition comes down to, obviously, kind of some of that inner dharma stuff, right? Where people have to kind of figure some things out for themselves. How can you achieve that enlightenment? How can you achieve that, whether it's a shared journey or an individual journey? If you're a healthcare provider, can healthcare, design a system to help people, achieve those things? Weirdly enough, right? I mean, whatever. I mean, there's different places that set up systems to empower people to be, the best that they can be. When you think of a militarized system, right, and you think of, like, the U.S. military, I mean, that's a system helping people be, quite healthy, right, and quite aligned to a goal, right. And you look at the big structure there. Obviously, maybe mental health is not something coming out of war that's going to be, fine and dandy, but you look at the ability to, empower lots of people to do a big thing. Sure, if you were going to go to war, right, maybe the U.S. military as of like 2024 is not something to look at, but I don't know, I guess, think of a sales team, and, in an ethical fashion, right, if you've got somebody, working at the height of their happiness and the height of their, reality that they want, and they're just happy, someone's going to have better performance. Same thing would happen in life, right? So whether, somebody's trying to get you to be your best so that you can just have, the best outcomes in your life, whether they're, health outcomes or financial outcomes, or, I don't know, relationship outcomes, or whatever you want to consider, important in life. I mean, that's precision medicine. That's personalized medicine, right? Getting down to specific needs of the individual and things like that. And so, creating systems that can help individuals get down to those points, and then reveal those points properly to their healthcare providers, getting them the extra attention or information that they may need, or to get empowered, and also have that, shared reality of, working on your own health care together, and you empowering you to, want to achieve your best health. That's the giant, kind of situation there. That personalized medicine, I think, could go beyond a precision genetic mutation or needing a pill or anything like that. And so, where you think of things like, the brain being a plastic, malleable, growable substance, right? 3-pound mass in the head. I mean, you think of the reframing abilities there, and if you could reframe your outlook to be what you wanted it to be in life, which was, good things that help the world, and then you could, heal yourself and, right, have better effects. So again, if you're the doctor, the initial problem is maybe getting to the bottom of those complexities, as noted here, but also creating almost how do you create a awesome big system to help, fix that, and then, watch that evolve. So anyways, that's my ramble here, guys. Friday afternoon. Move on to our Herbal Wellness Corner, brought to you by High Horse Cannabis Company. Our segments, next two segments, we're going to be highlighting our show sponsors, guys. You guys are not shopping a High Horse Cannabis Company 24/7, 365 over at the Valley and Mains locations, 7 a.m. to midnight over at Chaparral and Hobbs on the state line, guys. You already know High Horse Cannabis Company, your go-to full-service dispensary, proudly staffed with the most knowledgeable bud tenders in the industry. Trained by moi. Our team is dedicated to guiding you through an unmatched cannabis experience. Plus, we offer the convenience of drive-through service at all our locations, making it easier than ever to access top quality products and expertise. Your journey to informed enlightenment and effortless enjoyment starts at any of these 4 stores. Solid deals and specials, guys. Telling you great stuff. You put in your order, it's ready right away. Special deals at High Horse. $25 ace, $100 ounces from Animus, cannabis, awesome stuff, guys. Stuff up to 30% in these stores right now. $25 all farmers concentrates. 50% off all farmers chocolates and infused pre-rolls. Plenty of other discounts and things going on, guys. Our stuff, Farm True 1-to-1 gummies. Go grab some of those for the weekend over at your High Horse Cannabis Company location. Our little dispensary is only open 11 to 5, but we're saddled up everywhere else with High Horse, baby. So I'm the director of training there. Our bud tenders at High Horse are awesome. We work very hard to really, be knowledgeable. So you can come and ask questions. I don't care if it's 24/7, 365. Someone's going to be very prepared to help you out. All right, move on. Next segment. Next sponsor, want to show some love to, guys. Big Chicken Farm. Showing a little of their Instagram because I like some of their, layout here. Big Chicken Farm. State-of-the-art cannabis cultivation and production company in southern New Mexico. Top priority to provide the highest quality products and services to our businesses, partners, and consumers. We take great pride in our facilities designed with the latest innovations in mind. Our team of experts work diligently every step of the way to ensure that only the finest cannabis products reach the shelves, guys. Quick one on the website there. But if you guys want to find Big Chicken Farm, fire. Cardiel Cannabis Company, Saint Cannaba, The Greenery, Yerba Buena, Zia Collective, Mr. Good Bud, Southwest Dispensary, Factory Direct, Mindscape, Elevation 3789, Reverie, Moss Buds, Yucca Point. Guys, awesome stuff overall. Shout out to our segment sponsors there. Please go give them a visit for sure. Any of those stores, guys. Locally owned, locally grown, fire. All right, so let's end this one on a fun note. Men's Health Minute, guys, making our picks tonight. Conference championship stuff this weekend. We have the Chiefs versus the Ravens, the Lions versus the Niners. All right, so last week, I was thinking with my brain maybe a little too hard. Maybe you got to think with your heart. I don't know. I really don't know. But, my heart, I'm going for the Lions. I want them to win. I'm picking them to win. And my heart, I'm going for the Ravens. I want them to win. I'm picking them to win. The Niners have been torching the NFC, the last 5+ years. Sick of it. Obviously, the Cowboys get exposed on their own, but I want to see Dan Campbell push through. That's a fun story to watch. Feel good story of the year. Dan Campbell, obviously, and then the Ravens deserve one. Unless you are a diehard Chiefs fan, I think need no explanation there. She who must not be named. We're all done with that. Maybe not. Whatever. Isn't to take a shot at the ladies. It's not that. Anyways, all fun. Everybody has a wonderful weekend. Dr. Joaquin, go shop some High Horse, baby, and we will see